Are you trying to quit? Nicotine patches haven't been studied as much for helping youth stop vaping. However, we know some people do find them helpful, particularly when used under health provider guidance for a limited period of time as part of a plan to cut down or quit. If your healthcare provider recommended the patch, using it correctly makes all the difference. Here's how it's done. Step 1. Choose a clean, dry, and hair-free area of the skin on your upper body. Make sure that your skin isn't irritated, and skip lotions or moisturizers on the area. They can mess with the stickiness of the patch. Step 2. Remove the patch from the package. Peel off the protective liner just like a sticker. Try not to touch the sticky side. Step 3. Immediately apply the patch to your skin and press firmly for a few seconds to ensure it sticks well. The patch will release nicotine throughout the day and get absorbed through your skin. Step 4. Wash your hands with water after handling the patch to remove any nicotine that may be on your hands. If your patch is not sticking well to your skin, you can try securing the patch with medical tape. Gently apply a strip of tape over the edges of the patch. Another option is to use an armband. Just wrap it around the area where the patch is, and it'll help hold it securely in place throughout the day. The patch should be applied once per day, usually immediately after waking up. Keep the patch on for up to 24 hours or as directed by your healthcare provider. Switch spots daily to avoid irritating your skin. Your skin will thank you. After 24 hours, peel off the old patch. Fold it in half, sticky sides together, and throw it in a safe place, away from pets and other people. You are taking a huge step towards gaining control of your health. Quitting may be tough, but your healthcare provider has suggested the use of patch to make it easier to quit and stay quit. For more details, including possible side effects, check out the pamphlet that comes with your patch.